So today we'll be talking about the post-operative care, post-endoscopic hemorrhoidectomy or laser hemorrhoidoplasty. Before I do delve into all of that, I just want you to remember that post-operative swelling, bleeding and pain, burning, pruritus, or itchiness is normal during the recovery process. If you did the laser hemorrhoidoplasty, for most patients, this can last anywhere from a couple of days to a couple of weeks. And then if you did the endoscopic hemorrhoidectomy, this typically lasts anywhere from a couple of weeks to a month. It's rare that it would be severe or long-lasting, especially for those who did the laser hemorrhoidoplasty and their hemorrhoids are quite bad, or if they've been on the steroid creams, like the hemorrhoid creams that have steroids in, or even the suppositories. The skin tends to really thin out. Or patients who are just genetically predisposed to a lot of swelling after any kind of trauma, those patients can have severe swelling that can last for longer than most patients, sometimes several months. All we can really do if this happens to you is to just wait. It will eventually die down over time. Now, post-operative care. It is a 2-week treatment regimen, but you can do it for longer, especially if you continue to have a bit of symptoms or if your recovery is a bit more prolonged. So we do recommend ice insertions. So what do I mean by ice insertions? This is optional, but highly recommended, especially for those who did the laser hemorrhoidoplasty. Essentially, you take a glove from the clinic. We can provide you with some. But take a glove and then fill the index finger with water and then tie it, put it in your freezer. So you're essentially making an ice popsicle out of the index finger of the glove. And you can lubricate this with regular lubricating jelly, aloe vera, or xylocaine jelly. Up to you. Xylocaine tends to be more expensive. Aloe vera is nice, but whichever one works for you, feel free to use whatever. So just take that ice popsicle, lubricate a bit of the jelly on the outside, and then put it inside your butt. Now you're going to leave it inside for about 10 to 15 minutes. Wait for it to melt. This will really help reduce the swelling. We do recommend to use this anywhere from at least like 3 to 4 times a day, ideally. But obviously, if you're working, it's kind of hard to do that. So maybe you just do it like in the morning or nighttime. Again, it is optional, but highly recommended. What are the more mandatory things that we do recommend? After the ice insertion, definitely twice a day for at least 2 weeks, Proctal suppositories or whatever suppositories you prescribe. This will also help reduce the swelling. It'll also help prevent infections as it does have antibiotics in it. So it's very important to use it every day for at least 2 weeks, twice a day. And then you're going to be on a low residue diet. So essentially, no fresh fruits or vegetables, no whole wheat products for a couple of days. We'll give you a handout that discusses more about what you can eat, or you can just, use the internet, check out low residue diet. And then take that for about a couple of days. On the 3rd day moving forward, you can eat whatever you want, but typically we recommend high fiber diet. And then starting on that 3rd day as well, when you start eating whatever, start taking stool softeners 3 times a day, and then fiber supplements at least once a day. However, even though we say 3 times a day stool softeners, fiber supplements once a day, adjust according to your bowel movements. For example, even if you are taking it just like that, but you're still constipated, take more, and possibly even try a laxative. What you want are at least 1 to 2 bowel movements a day that are soft and formed. If you are having diarrhea with stool softeners 3 times a day and fiber supplements once a day, pull back a bit. Again, adjust according to your bowel movements. We do recommend to do this for at least a month, just so that you don't aggravate the healing process. Because if you're constipated, especially during this time, it can make the healing process longer, and you may develop, more hemorrhoids. Now, aside from this, definitely we do prescribe as well painkillers. However, a lot of patients don't actually need this. It's there just in case though. always try to take Tylenol or Advil first. Or you can take both at the same time if one doesn't work. If you're taking 2 of these and you're still in pain, we do recommend either celecoxib or naproxen, whichever one we prescribe for you. And then if that doesn't work, then T3s. And if that doesn't work, then Dilaudid. The last 2 are narcotics. Again, most patients don't need these. And these narcotics can cause constipation, bleeding, and addiction. So as much as possible, we don't want you on it. Again, it is there just in case. If you are using the narcotics and also if you are constipated, it's probably prudent for you to take laxatives as well to help prevent that constipation. And then we do recommend this whole treatment regimen, especially the things that you insert up your butt, for at least 2 weeks. You do have enough refills for about a month and a half. If ever you have problems afterwards, during the recovery or anytime afterwards, feel free to reach out to us.